Okay, so I think we are live here. Thank you all for attending today for our discussion on hot topics and policy and politics related to health information, statewide and federal updates. It's about 12:02 here, so we'll go ahead and give it a couple more minutes just to allow others to hop on, and we'll go ahead and get started at about 4 or 5 after the hour. So we'll go ahead and get started in just a couple minutes here, and thanks for your patience. Hey everyone, if you're just joining us, we're just getting started around here and waiting for others to join. So we'll go ahead and get started in a couple minutes. So thanks again for your patience, and we'll get started soon. Thanks. All right, so my laptop says 104. My phone says 103, but I think we're at time that we can go ahead and get started here. So thank you all again for joining today. Today, on behalf of the Arizona HIMSS chapter, we're going to be talking about hot topics and policy and politics. Rebecca, did you want to say do any admin before we go ahead and get started?
Sure. Yes. Hi, everybody. Thanks for joining us. We have just a couple of HIMSS items we want to make sure everybody covers before we get started today. So thank you for being here with us. First, we have to thank our sponsors, Pivot Point Consulting, CDW, Contexture, AP Professionals, and Nutanix. None of this programming would be possible without them. So we want to make sure they get a good shout out from us today for supporting HIMSS. Just as a reminder to everyone, our vision is to realize the full health potential of every human. And we do this by reforming the global health ecosystem through the power of information and technology. Thank you all for being part of that mission and making it possible. A few upcoming events that I'd like to make sure are on your calendar. Don't miss our September 15 webinar. It's going to be on care innovation, what is working and what is not. And we're going to have some excellent presenters, Dr. Eric Bowman, Dr. Erica Pabo, and Tina Perbine. So make sure to put that on your schedule. On September 22nd, we are doing the casual meetup, and actually the location has been determined. So I'll make sure to update that. The address is going to be 6125 East Indian School Road. I'm actually hosting it, so I'm happy to be able to have everybody here at my office. We have plenty of room, and we would love to have you at the casual meetup. The last one was very well attended. I think not this Friday, but the previous Friday. I was happy to see a lot of you there. So hopefully we will have an even bigger turnout this time. And it is being hosted, so even better. And then on October 14, you must be at the annual health summit. This is the not to be missed event. Last year's was fantastic. I know that the lineup this year is even better than last, if that was even possible. And we are making sure everybody knows about the early bird ticketing that's available now. So make sure to get that before September 2nd so you can get a little bit of a discount there. So don't forget, we have all of our events up on the website if you want to see the remaining programming. So with that little bit of announcement information, I'd like to get to our speakers. I'm really excited today. We have Nicole Fries with us. She's the Associate General Counsel of AHCCCS, and she's going to be sharing with us her point of view from the state perspective on some topics that we need to be familiar with. We're also going to be we have here with us Willa Murphy from our legislative liaison from AHCCCS, and then our host and moderator for today, Chase Millea, or did I pronounce that right?
Millea, yeah.
Millea from Snell and Wilmer. And so I'll turn it over to you, Chase, so you can introduce the panelists and get the topics going.
Great. Thanks so much, Rebecca. And thanks everyone again for joining today. So we are having a little bit of technical difficulties with one of our panelists hopping on. So forgive us in terms of our plan was to have a kind of more fulsome overview of kind of the federal goings on. And so hopefully Mari is able to join us a bit later down the road and give us those updates. But we are very well equipped here with Nicole and Willa, who are both coming from AHCCCS. So we know that as the Arizona Healthcare Cost Containment System, our state Medicaid agency, and really just kind of one of the biggest players in healthcare in Arizona. They do, the agency is kind of unique really among a lot of the US, where AHCCCS has been so involved and so invested in, in participating in legislative and other kind of opportunities for making sure the healthcare of all Arizonans is taken care of. So maybe just by way of getting us started, Nicole and Willa, in terms of a legislative update from the state perspective, from the Arizona perspective, do you want to just kind of go ahead and get us started on maybe an overview of the latest term and just kind of have that start off our discussion?
Well, we actually have some poll questions.
Oh,
for
okay.
everybody to see if you're paying attention.
Polls.
It's the beginning instead of the middle, so
Great.
hopefully more of you are. So if we can queue those up, that would be great. But I will also take this opportunity to say that although Willa and I are coworkers at AHCCCS, we are appearing here in our personal capacity, and these are not opinions of the agency, anything that we cover today. So there's 3 questions. Go ahead and answer them, and then I think it'll probably queue one after the other. So once we get enough here, I don't know if we're going to be able to see the response, but Willa, I'll let you kick it off.
Great. Yeah, so we do have those 3 poll questions out. I'm not sure. I saw one pop up. I'm not sure if they're all going to be going. There's a little insight. Each of those 3 poll questions kind of touch on some different themes and trends that we wanted to highlight again in our personal, not professional capacity.
So we have 9 out of 10 out of the 12 on the first question.
Great.
Do we know our answer?
All right. So Arizona independents can vote in Arizona primaries, but it's not as open as some other states. So Arizona has what's called semi-closed primaries, meaning that in general, in order to vote in the primary, the voter must be registered as a party member to participate in that party's primaries. Independents are still eligible, but must choose one party to vote in. So if you're an independent, you can't vote in both the Democrat and Republican primaries, and so voters have to specify which type. And this is actually, well, while you're taking a look at that other question, just wanted to highlight the importance of primaries in Arizona's legislature, especially as a result of redistricting. So as you know, we have a bicameral legislature with 30 state legislative districts that each elect 2 House members and 1 senator. So that's 30 total members in the state Senate, 60 total in the House. And every single member of the legislature, both houses, have to run for re-election. Their terms last 2 years. So every 2 years, we do have an opportunity for quite a bit of turnover. And that's even more pronounced this year as a result of redistricting. So only 5 of Arizona's 30 legislative districts, as a result of redistricting, are considered competitive. Do you want answers in for the second?
Do we have our answers?
We're still waiting for 2 respondents, 10 out of the 12 on question 2.
Okay. I think we're good to go ahead, Willa, and give us our answer here on how many of those legislators.
Jason's calling it. Okay, of the 4 members who in the previous legislative session served as the chairs or vice chairs of the health committees, 3 will not be returning to their seats. So the correct answer, I saw the results. So just going through those, again, so in the House, you had the Vice Chair, Representative Kaiser, who is now moving to the Senate. He will not return to the House. You also have the Vice Chair, Senator Pace, and Senator Pace, who is the Vice Chair of the Senate Health Committee, and Representative Osborne, who was the Chair of the House Health Committee. Both actually just recently lost in their primaries. So the only returning member in kind of those leadership positions on either of the health committees, as a result of taking into context the primaries, is Senator Bartow, who currently serves as the chairwoman of the Senate Health Committee. But however, as a result of redistricting, she's actually in one of those competitive districts in the general election against another incumbent. So not just in the health committee. In general, there will be quite a bit of turnover, but that is pretty pronounced, I would say, for committee leadership.
And Willa, when will we know likely when the new committee placements will come into effect after the general election? When will we know when people are in their seats? Ish.
It's a great question. It really depends. The first thing that you have to do is, upon the general election, both parties need to elect leadership. And that's important because those leaders, so for example, the Senate President and House Speaker, both retired or will not be returning from this past year. And I'll get into that a little bit, but they are who assigns committee assignments. And it can really differ depending year to year. So you have, turnover, folks just won't be coming back, and then some folks won't be assigned to the same committees. So typically you do find out those assignments in December, but I think it was a couple years ago, we really only found out early January, so about a week ahead of committee starting.
And because you mentioned, it sounds like because of the broad leadership at the Senate and House level is changing, we can probably expect this to most likely take a bit more time because it's not just the health committees with these substantial changes. There's substantial changes happening everywhere in the legislature.
Right.
Great.
Exactly.
Okay, next poll section or question.
All right. So am I good to answer it?
Rebecca, are we ready for the answer?
Yes, we had 9 out of 13. So we'll go ahead and poll and share results.
Okay. Yes, correct. So the longest legislative session.
Wow, this is a smart participant group here. We've got a pretty clever participant group here. They know these detailed questions.
No, I love it. Folks are totally, and I do apologize if I'm covering ground that y'all are familiar with. But I wanted to level set. It is correct. It is 173 days, and that was in 1988 during the impeachment of Governor Evan Meacham. I do appreciate the folks who put 200 because it certainly feels that way sometimes when you're getting towards the end. And just a little bit of background. So this previous session was 166 days. The 2021 session was actually close to that limit or that maximum of 173. The 2021 session was 171 days. So unlike other states who have designated beginning and start dates for their legislative sessions, or some states who go year round, Arizona's legislative session has a designated start date, but doesn't really have a designated end date. Technically it's 100 days, but that's very atypical. And it really does usually depend on budget negotiations. So usually see the session ending once the budget is passed. For example, this year budget was passed June 23rd. Legislative session ended June 24th. So I think I would say 2021 is probably, without the impeachment considerations back in 1988, one of our longest sessions.
Very interesting. And so I guess, and hopefully I'm not jumping too far ahead, but now we mentioned the 160 some odd day session last session. Do we want to start talking about what happened in the 22 session?
Yeah, happy to do so. No, it's great transition. I appreciate your assistance and
that's
thanks
why I'm
everyone
here.
for
I'm the moderator.
Yeah, exactly. Thanks everyone for answering those poll questions. So I just wanted to highlight a few themes that I think are interesting and folks may be interested in related to the past legislative session. There are quite a few things making it unique. First, as I mentioned, it is an election year, which makes things a little bit more political in general, but that was kind of heightened due to the redistricting. So as you know, every 10 years, the census is completed and new districts are drawn, including congressional districts, but also these state legislative districts. And as a result of COVID-19 delays in the census data, a lot of things were delayed, but essentially what ended up happening was, I think it was late January. So after legislative session had already started was when those new legislative districts for which folks would be running for office, this fall were released. And that was fairly late. So a lot of folks were redistricted, which further complicates an election year. Second theme I just did want to touch on is majorities have been historically tight for the past few sessions. So in the Arizona State Senate, for example, is 16 Republicans and 14 Democrats. In the House, it is 31 Republicans and 29 Democrats. That's a literal one vote margin in both houses. And Arizona, go ahead.
Sorry, Willa, is that's going to be for next session too? That'll be the arrangement. That's what we're looking at, or we don't? Oh, right, because we haven't had the election yet. So that was the 2021, 2022 arrangement.
Yeah, what Willa said earlier about the lack of competitive districts. So it's not going to change dramatically, but you said there's 5, right, Willa? So in the general election,
right, 5 competitive. There's really less than that are truly competitive in the general.
Okay,
I would
so
say.
maybe
Sorry,
3. But as we said, with the margin being that tight, 3 could make a difference.
Sure.
But it'll still stay narrow. So that trend will continue. It just could flip. We don't know until after the general.
Got it. But some form of trend of around 50-50 in terms of the party disbursement is probably going to likely be what we see for the future going on here.
Yeah, and I'm glad you brought that up, Nicole, because so many of these races are decided in the primaries. Many folks are either in completely non-competitive districts or don't have a general election challenger. But it is going to be quite tight likely. And that one vote majority, although I'm unable to predict what the majority will be as a result of the general election, it does make it so that each member has essentially a veto in those majority partisan bills. So it creates a unique dynamic, I would say, and difficult for leadership. But you also saw this year the announcement of the retirement of longtime Senate President Fan and the retirement of longtime House Speaker Rusty Bowers, who actually did run for a Senate seat, but lost in the primary. And combine that with the last year of a gubernatorial administration just means it is a lot of folks, trying to get legacies in, but also the awareness that this leadership will be changing, and we really don't have a good sense of who that might be.
So just in terms of the long and the short for next session, we can expect no matter what, we'll have a new governor. So that's going to be at the top level. We're likely to expect probably about a 50-50 split leaning one way or the other, with just those handful of competitive districts laying out. And it sounds like we're going to have a completely new set of people no matter what too, because of a number of people who either lost their primary or are transitioning out of their seats. So, just for the group, it sounds like for next year, as we're all paying attention to the legislative session, we're going to want, it's probably going to be some new faces and just a lot of new things going on. So it sounds like it's going to be an exciting session for 2023.
Exciting is one way to put it. That's correct.
Yes,
it'll certainly be interesting.
Very good.
Very good.
And
yeah, I mean, the reality is that a lot of the processes, committee selection, rules that are really able to be dictated, and differ based on House or Senate and are not contained within the Constitution or statute, they really do depend on leadership. I think one of the big things to watch will be who is elected to be the new Senate President and House Speaker. So that'll certainly be very important in shaping next year's legislative session.
And having this many new members means that a lot of policy work looks more like education. So, that happens a lot anyways at the state level because of to your terms, but with the lack of leadership or committee leadership in the space for health, these are complicated topics, and so a lot of requests end up looking more like education.
Great. So with that in mind, kind of painting the picture for maybe what we can keep an eye out for, do we want to maybe talk about what the past session looked like and go into kind of a deeper dive into those substantive healthcare items we wanted to discuss?
Yes, certainly.
Over
So
here,
I'll just touch.
I
love it. It's great. Certainly, I'll touch on a few items that were in the budget and then turn it over to Nicole to discuss some other bills. So just wanted to highlight some relevant items in the budget package for state fiscal year 23, particularly for those interested in the general appropriations or feed bill and the health budget reconciliation bill, which either relate to access or healthcare and technology. Full disclosure, if the bill doesn't relate to access, I will be a little less familiar with it, but I did try to curate some interesting things for the group. And you really did see, just in general, but that'll come out in this conversation, a willingness on the state to fund some of these more requested updates to, for example, technology infrastructure, and just a lot of new funding or grant programs as a result of this budget surplus.
Wait, just to reiterate, Will, I heard, and maybe just to make sure our attendees are aware, I heard there are new funding and grant and other opportunities for healthcare stakeholders in the state of Arizona with regard to building out technologies. Is that what I heard?
That is potentially the case. And as I stated, many of them are not through access. So I did highlight the exact agency which will be administering those programs. And if you're interested, you can also certainly view the state's procurement website, which has those opportunities as they come live. Although I would note that the general effective date of most bills is September 24th, 2022. So if there's language, for example, contained within a regular bill or in the health burb in the budget reconciliation bill, then that will not be in effect until September 24th of this year. But I'll certainly keep those in detail. keep those details in the conversation. So a couple of access items, which are just for our agency's budget request, did make it in. So for example, funding for a system integrator for access for our, to begin the process of replacing our agency's 30-year-old prepaid Medicaid management information system, PMMIS. So that was designed and implemented about 30 years ago and has some really arcane coding language. So we're excited to get that system integrator in and start that process of modernization and modularization. Another budget request related to this from Access was funding to achieve compliance with the federal interoperability regulations that I'm sure folks on this call are much more familiar with than I, but just making sure that we come into compliance with that. And outside of Access's budget requests, you did see some substantial investment in related issues. So for example, a $10 million appropriation to the Department of Homeland Security for a cybersecurity grant program, $2 million of which is for state agencies and designates a procurement process for that. The budget also established a healthcare interoperability grant program to be administered by the Department of Administration and appropriates about $12 million for that, with the purpose of providing grants for interoperability software technology solutions for certain provider types, including rural hospitals and urban trauma centers. And the budget also established the Arizona Health Innovation Trust Fund within the Office of the State Treasurer, and that is for a designated nonprofit entity to promote education and workforce development for the health innovation and healthcare delivery sectors. So those are just a few of the related items. There are quite a few items in the budget that related to access, like covered services or for example, eligibility provisions that I'm happy to get into in questions, but didn't want to necessarily focus on that. We did just want to add one bill of note, which I found interesting for the group and could be a kind of a portend future trends potentially related to legislation, which is technical and seemingly innocuous, but which could raise issues. So this year, one bill that was not passed into law was it was introduced in both the House and the Senate. So it's HB 2100 and SB 1167. The short title of these bills was Health Information Organizations, Confidentiality Data, and essentially would have allowed Contexture or the state's HIO, HIE to receive, use, and redisclose confidential information received for any purpose allowed by HIPAA. And ISIS wasn't directly involved, so I'll certainly defer to others, many folks who are more familiar on this call, but just for general awareness, a substantially similar bill in the 2021 session actually passed the House and Senate with unanimous support on the floor, not a single vote against. And that was not the case this year. So in the House, for example, passed on a narrow margin with the Republican members largely opposing it, and was then held prior to moving to the House floor, with members specifically bring up concerns that it could be used for a federal vaccine passport type of issue. And the concern, as with many bills, the concerns that are raised in committee or on the floor may or may not be related to the actual language of the bill. But you did see those concerns again in the Senate, where same concerns were mentioned, got out of committee, but on the floor was amended to specifically state that the HIE may not use or disclose identifying information from the childhood immunization reporting system for purposes of inclusion in a federal vaccine database, or for any purpose that serves to discriminate against individuals based on their vaccination status. So just wanted to highlight for the group, because it is a interesting kind of combination of issues and a real politicization of these seemingly technical or health information exchange bills that is certainly something to be aware of and just monitor. As Nicole mentioned, we will be having many new members, and it does require some education, but it's also helpful to just have these examples of remembering, hey, that happened last session, let's make sure that this is communicated or just to be aware of. So that was a bit of a lengthy explanation, but I think an important example of how things can change from year to year and how bills can be perceived. So definitely we'll take questions after Nicole, but Nicole, I believe, has some other bills to discuss.
Chase, did you want to say something?
No.
Okay. But kind of on the nature of our state health information exchange. So they did get a win in one of the bills this year related to the healthcare directives registry. So not necessarily fully within the wheelhouse for this group, because it is related more to kind of personal end of life planning, trusts and estates, but very useful to our medical professionals. And the HIE is the channel that this information is being pushed out, because individuals now, when they file a healthcare directive with the state, it goes into the HIE, it's going to follow their personal identifier. And so if they're receiving treatment somewhere and whatever, occurrence happens, that the physician, nurse, whatever might need to look it up, it's going to be that easy. And I think that solves a big problem, because previously the AG's office monitored the healthcare directives registry, but it was pretty clunky. I think it was essentially an electronic version of a paper registry. And so I don't even know how providers would get that information previously. So this is a big step forward, I think.
Yeah, that's a great, and just to color that in, and when so full disclosure, I used to be in-house counsel over at Health Current, and now Contexture, and we're working on the advanced care planning processes. And you're right, Nicole, and I think it was actually the Secretary of State was the one in charge of managing these documents. And as a practical matter, no one was getting a hold of any of these advanced directives. So when we talk about do not resuscitates and things along what people want for their end of life care planning, in terms of whether there's certain treatment decisions and anything along those lines that they can document, people would often fill out those forms and have them kind of have it in their house or something along those lines, but then getting that across to a particular provider or across town to the right hospital, the emergency room that might be providing that emergency treatment, was just not happening at all. So this is just a great opportunity and just a cool thing happening in the state of Arizona, where digitizing all of this, putting it all through one source like Contexture, hopefully we'll be able to make those documents available on a much broader basis and really just adhere to, what those people's last wishes are that are often, again, documented but not shareable. So that's really a great change to see for the state.
And then the other thing that we wanted to draw attention to, and again, maybe tangentially relevant, but a trend, and I think a good trend, was related to some licensure bills. So one of the big ones, which will only really be relevant through the end of this year, because it expires at the 1st of 2023, is kind of a follow-up from COVID concerns. There was an executive order previously that allowed existing licenses to continue without requirement for renewal during a certain period under the public health emergency. So this bill was passed in order to extend those temporary licenses through the end of this year. So just relevant for any providers who haven't yet initiated their renewal process, because by the 1st of next year, a valid license that's been renewed is necessary. But I think another sign that kind of that COVID-19 unwinding is coming. I'm not sure how relevant it is to the group, but as of right now, the public health emergency is set to expire in January until the administration renews that. It looks like, along with this bill, that's sort of how the state is also approaching it. There was a small bill related to outpatient treatment centers, allowing them to operate under the hospital's license. Obviously very technical, but a flexibility that I think is really useful for many of our hospitals that have a variety of treatment centers sort of in their kind of compound. And again, streamlining that licensure process, which I think is probably going to be a benefit for most of our providers. And then there was another bill related to collaborative practice agreements that are specifically for pharmacists, but it allows and defines kind of what this type of agreement would mean. And it's related to drug therapy or disease management, obviously a complicated long-term diagnosis for most patients, but it allows delegation from the pharmacist. So I think another flexibility that the legislature has shown that they support for providers to kind of find a way that's best for the patient, but navigate around sort of outdated licensure rules. So hopefully, as we said, a lot of trends that we've seen, we can't necessarily guarantee they'll continue next session because of the issue with members, but these were at least heartening. There were some losses this year, but these were clearly very technical, and the provider community requested them and the legislature responded. So that's always a good sign.
Excellent. Well, thank you both for giving such a great review of the of legislation that went through in 2022. And so maybe just kind of to summarize what we talked about from an Arizona perspective, it sounds like there were a number of bills from a technical perspective where we did see kind of some expansion in the healthcare space, where we've got new funding coming in for cybersecurity and interoperability programs and the like, where we're building out that infrastructure from a healthcare perspective and an interoperability perspective, and the state is aware of that and really kind of financing those things. It sounds like, we're continuing to kind of have this battle around information and access to that information and who should access that. So when we talk about child immunizations, or we talk about allowing certain organizations to use data as widely as the federal standard under HIPAA, there's still definitely some consternation where we really don't have clarity there from the state perspective. And it sounds like over the next few sessions, or maybe it'll be all in this one upcoming session, but over the next few sessions, we'll probably be talking about these same items again, in terms of, what's the appropriate use of people's identifiable health information? Should the state be regulating that any further than HIPAA does at the federal level? And I think that sounds like we're kind of still trying to kind of iron that out, and we'll keep that going. And then lastly, from a kind of member perspective, it sounds like from an election perspective, we're really going to get a whole new cast of characters, because as you both of you did very well to share with our audience, there's a number of changes happening both at the kind of top level leadership at the House and Senate in Arizona, but then also at that critical committee leadership role where, often, and for those of us who have been down at the Capitol, the committee gets that first say. So if a bill doesn't get through the committee, then it doesn't really matter what whether it's 50-50 or whatever, because if it doesn't get out of committee, then the bill's going to die there, and we'll probably bring it back the next year. So great. Well, with that in mind, just in kind of that summary in mind, Willa and Nicole, is there any, and I should say, and Rebecca, I'm not sure if we have capacity for people to either, I don't know if anyone can unmute, but if they're able to send messages, to the audience generally, please feel free to send over any questions you have in the chat box or whatever. Do we have a mechanism to do that, Rebecca?
Yes, there is a little Q&A button that people.
Okay, the Q&A button.
We would love your questions.
Yes, perfect. Thanks, Rebecca. So yeah, again, to the audience, please feel free to click that Q&A button and submit any questions to Willa, Nicole, and I guess me too, if I can answer any. So maybe, and I know, and I did mention at the start of our discussion that we were having an issue with our other panelist, Mari, who was going to give a overview of some federal updates. And I'll kind of jump in the deep end in a few minutes here and do just a very brief federal update based upon what I'm aware of. But hopefully we can get Mari some information from her in front of the group, just because I know she's got such great substantive expertise. But maybe just for you and Willa and Nicole, just kind of generally, do you have any kind of final thoughts on, what should we be looking out for in terms of I know we kind of did that summary, but just kind of any other thoughts you have in terms of the 2023 legislative session, or, in terms of how you might see voting to come on, nothing political, but what should we be looking for in the next, what should be happening over at the Arizona legislature?
Yeah, happy to take that. As you mentioned, I mean, in general, it's quite a bit of uncertainty. So I guess the answer to your question is I cannot answer your question. But I think, you will see perhaps some more difficulty. Really, a lot of legislative processes go through, for example, having an executive branch which has kind of legislative liaisons or leadership who are known to members and who are familiar with the legislature and who can provide that information and who have the background. Depending on the gubernatorial administration, you may lose some of that background or education. So there will be a loss of, for example, a potential executive agency branch transition, which may create difficulties. I think the other thing to note is that, there's going to be new House Speaker and Senate President, who then will assign the new chairs and vice chairs, at least for the House Health Committee, and certainly a new vice chair for the Senate Health Committee. And those committee chairs are who determine what is on the agenda. So there is quite a bit of power. So it goes beyond even just if it fails in committee, it won't move forward. It's also if the chair does not wish to hear it on an agenda, then it will not be heard at all. And it is the House Speaker and Senate President who assign the bills to committee, and it's up to those committee chairs to set the agenda. So those really do have quite a bit of influence, going beyond just a lot of turnover in general, but those specific seats will be very influential, and it does vary substantially member to member. They may have different interests, they may have different experiences or backgrounds or levels of education.
Excellent. So uncertainty is the name of the game.
Yeah, the only thing I would add is just based on the primary results, it was to be expected following redistricting, also following our 18-month-long audit and a very contentious national election for Arizona. But, moderates did not win their primaries. Many incumbents lost. So to the extent that the party makeup might look very similar, most legislators, especially if they're new, are going to come in with their topics. And I think the greatest success that any of us would have is by finding one of our issues that aligns with their campaign promises, because they're not going to be interested in finding something that, both sides of the aisle agree on, not in their first session following an election. So finding, kind of like Willa said, finding the political sort of sponsor for your issue is probably the best way to actually get it to committee, if beyond that.
That's great. And that's really helpful, Nicole. And we've got a question that came in that was kind of related to that around kind of how do we recommend, educating members, what should it be like to engage with these new members? And I think that's absolutely right. Looking at, once we start to figure out over the course of whether we get it in December, like you mentioned, Willa, or it's extended because of all the change happening here, once we understand who the committee chairs are and what that will look like, you'll start to be able to see kind of who's in those powerful roles in terms of being in the committee chair position or committee vice chair position. And, to the extent your organization or the associations you work with are, are looking to bring something forward that year, or looking to bring some change to the legislature, that's where you're going to want to be building that groundwork up, right? Is to identify those relevant stakeholders. And, as Nicole, you were kind of alluding to how we're going to lose a lot of that institutional knowledge with a lot of these changes. It is also an opportunity for industries to establish that institutional knowledge, potentially from a clean slate. So, in as much as I think a lot of us are kind of uncertain and looking at how often politicized a lot of the kind of maybe not so political issues have gotten, there is good opportunity for health information groups and healthcare groups to continue to kind of have that strong voice in Arizona, and make sure to advocate that to members, and those members ultimately will, bring what their constituents, ask of them at just within some reason for those members. So, I think it's a great question in terms of how to specifically do that education. I think coordination is critical to that, making sure to work with your other stakeholders, Nicole and Willa, obviously having been with Health Current and Contexture, working with Access or the Department of Health or whatever, and unifying, I think, just from a general practical matter, the more the kind of healthcare community can all get behind something, typically that bill has a better chance than something where there's kind of disagreement within the community. And so the members are like, well, do I go with what this group is saying or what this group is saying? So, that's just kind of how that shakes out. Great.
I would also, can I add real quick? And
Please.
There's one other question that was just added that I'll respond to. So I would say it is an opportunity. If you've tried to push something before and there has been a barrier, those barriers are largely gone. So there is an opportunity for issues that maybe didn't make it through previously, but also, these topics are hard because they're so technical, but if you can find a narrative, especially for an legislator that doesn't understand the technical aspects behind it, if you can find a sympathetic family or fact pattern, like that's what they want, and that's easier for them to sell on the floor. It's easier for them to explain to other members. It's easier for them to put on social media. I mean, they're going to be looking for easy wins, especially after they've just been elected. So finding a narrative that they can understand technical issues about is probably the best way to educate them. And then the last thing that I'll say is related to the question of, what are their campaign promises? I would wait for the general election just so that you don't do double work. And then in November, you should be able to already see by just looking at their campaign websites what their sort of pet issues are, because it's going to be those topics that they continue to touch. A lot of times they're like single issue in the campaign. So they might not touch health in any way, which means you're going to have to start that conversation with them to see what they understand, if they think they understand a topic, if they're willing to be educated. But sometimes they do have health as one of their, 3 talking points. So I think it's worth looking into their campaign websites to see if they've mentioned it, and then you kind of know what angle to take with them. But I would just wait till after the general election. It'll still be a full month before session starts, but then you won't have to do research for both sides for those, 3 districts or so, right, Willa?
Yeah, and it also, if you're trying to get, do we have a list of new members? That will not be determined until the general election, obviously. So agree, Nicole. But if you are, maybe a smaller shop or have a little bit less time, you may want to wait until committee assignments are posted so that you can really focus on the committees that you're most interested in and have to do, 20-ish meetings or whatever, or 15 instead of 45 or 50. So I think that is just something to know, but that will take a little bit longer depending on when those internal leadership elections occur and then committee assignments.
Yeah, that's really helpful. Thanks, Willa. And not that we were turning this into a policy-making process webinar, but that's great. I think one really important take home is to understand kind of, especially in Arizona, those health committees in Senate and in the House are just very powerful committees, frankly. And so, looking at them and making sure you understand leadership in there, who are the members of that committee, in terms of getting started with what small shop or otherwise, in terms of like being the most resource conscious in term, how you're going to, use your resources to bring about, advocate whatever type of issues you're looking for. Narrowing to the committees, narrowing to those committee leadership and committee members is going to be the most efficient way to kind of, ideally, find a champion there who supports what you're trying to do. And then that person can kind of bring that up and be the person who advocates on your behalf. So that's really helpful. Well, thank you both so much from a state perspective. This has been really, I think, a great illuminating discussion. I think we got really good perspective on kind of what the legislature is kind of what they're thinking about, what the composition might look like next year. So this has been really helpful. Thank you guys both for participating in that. Just super briefly, and again, I'll apologize one more time for our lack of a federal overview. One of our panelists was not able to make it today, but I'll just give the very brief overview. We talked, I think everyone is aware of the Inflation Reduction Act in terms of things that came down in that act. We saw obviously where Medicare is going to have capacity to negotiate prescription drugs. That's coming down in a few years from now. Similarly, we're seeing sooner than that, we're going to see caps on insulin. So for diabetics, there's going to be caps. I believe it's $35 for ongoing insulin. And then, I think there's a number of changes with regard to the Affordable Care Act and making those insurance, whatever we pay, the things like deductibles and those other things. What's the other thing that's not a deductible? Anyway, so premiums, insurance premiums, keeping those insurance premiums low. So that's in the Inflation Reduction Act. I don't have a super, I think, unfortunately, our panelists would have been much more versed in kind of the details of that and kind of what the sausage making looked like that. But I think overall, I think we're seeing generally more kind of authority being apportioned to Medicare. So growth in Medicare, where they're going to be able to now negotiate those prices and kind of be a more kind of unhinged stakeholder in that healthcare space. And then we're seeing, continued support for the Affordable Care Act and continuing that implementation of low cost healthcare, in the private marketplace. And so, we'll see that go with the Inflation Reduction Act. Just in terms of a few other things I've been keeping an eye on, we do have a proposed rule in terms of revising HIPAA. So there was this was a while ago where we saw the Office of Civil Rights released a notice of proposed rulemaking to make changes to HIPAA. We had a public comment period, but we have not seen any feedback to something like a proposed rule or anything along those lines. So that's something we're waiting on. Probably not going to see like a complete rewrite of HIPAA, but I think, a lot of those updates where a number of us who kind of practice in that area or deal with HIPAA on a daily basis, maybe those pinch points, that's, I think, what OCR is trying to address. So just I think the long and short of it is over the next few months, or maybe longer than that, because it has been a while, we might see some proposed changes to HIPAA. And we'll go through that kind of rulemaking process where we do see more public comment and the like. And then potentially end up with a final rule. So that's something to keep an eye out for. We've seen some continued progress with the information blocking rule. I'm not aware which is intended to apply to healthcare providers and others in the health IT ecospace, so developers and other vendors in the health IT ecospace. Generally, what the information blocking rule does, that was a part of the 2016 21st Century Cures Act, and it prohibits any of those actors, so healthcare providers and health IT vendors, who are operating certified health IT, from basically interfering with the access, exchange, or use of electronic health information. And so, long and short of it is there's kind of a tension there with HIPAA, right? So I think all of us know that HIPAA says we can't disclose health information or protected health information unless we've got the patient's authorization or one of those other exceptions applies, like treatment payment or healthcare operations. Now we're going to be, and we have been kind of figuring out how do we deal with then that balanced against the information blocking rule that says that we've got to disclose and cannot interfere with the access, exchange, or use of health information. So, we're waiting on kind of, that's a long-term goal, I think, for the Office of the National Coordinator for Health IT, or the ONC. But, something to keep an eye on, just kind of to keep aware of as we see potentially information blocking enforcement, and see kind of how that all shakes out. But, in terms of a buzzword to keep aware of, information blocking, it's real. It was part of federal statute in 2016. It's taken a while to get off the ground, but, I think we'll continue to see that moving forward. And then finally, I just wanted to bring up, and I had written a blog about this just a bit ago, but one thing to be aware of, I think many of us are aware of the California Consumer Protection Act, the CCPA, and Consumer Privacy Act. I'm not a California lawyer, but anyway, long and short of that is that is intended, and whenever we go to various websites, you might see those little privacy notices at the bottom, right? That CCPA is intended to protect consumers' personal information. So, and does include someone's health information. So, one thing to keep an eye out is whether or not we might see a federal version of the Consumer Data Protection Act. And so I think a lot of us are typically in a space where we're working for covered entities or working for HIPAA business associates. And so potentially a Consumer Data Privacy Act would not apply, but to those operations to the extent we are a covered entity. But to the extent that, our organizations are not covered under HIPAA, the question will be if and when a Consumer Data Privacy Act does come before, does move through both federal houses and is signed by the president, what will that look like for healthcare entities who process protected health information under HIPAA? That's something we're all used to. But what happens if there's a Consumer Act that says now, okay, if you've got some other category of health information that's not covered under HIPAA, then there's certain other obligations. So I'm blanking on the name of an act that was moving through the Senate, I believe, at the federal level to, again, create those consumer data privacy protections. I don't think it's probably not going to go through this session. I don't think it's something that, that it's like kind of an immediate burning issue, but just something to be aware of. There's talk at the federal level of a consumer data privacy law that would be very similar. Many of us have heard of the GDPR, General Data Protection Rule, in the European Union. Talk of that happening here. So something to be aware of. And, as we go through that process, that lawmaking process, we'll kind of see how that shakes out, and we'll see how that applies to various healthcare entities going forward. Okay, so with that in mind, thank you all again for attending today. Thank you, Willa and Nicole. That was excellent. Thank you so much for bringing a great perspective from your own perspective with regard to the Arizona legislature, and some really great insight for what we might be able to expect in the 2023 session. Again, apologies we didn't get deep into the federal discussion, but I think hopefully with Nicole and Willa's great discussion, we kind of really did drill deep into the Arizona discussion, and so hopefully that was that was great for everybody. So again, thank you all so much for attending, and Rebecca, thank you for hosting. And as Rebecca noted, there are a number of events coming up for the HIMSS Arizona chapter. So please feel free to check out the site and look at those new events coming up. And with that, I think we'll go ahead and adjourn, unless Willa or Nicole, you have anything else to add. I think we're good. Okay, so thank you all again, and yeah, we'll look forward to seeing you next time.